A public health expert believes Africa can still beat tuberculosis. It is believed that TB might have killed more people than any other microorganism ever known. It was recorded as an epidemic during the 18th and 19th century when it was known as consumption. Now, the World Health Organization says each year the African region receives about $1.3 billion for TB prevention and treatment. Joining us now for his thoughts on how Africa can defeat this stubborn pathogen is public health expert Dr. Maclawrence Famuyiwa. Dr. Famuyiwa, good evening and good to have you with us tonight. Has the advent of COVID-19 lessened the nations and the globe's focus on tuberculosis and maybe made it less important than what we should actually be doing?
Well, no, honestly, when you compare COVID-19 to the TB, COVID-19 seems to have killed more people in recent times than TB. But over the years, TB is the most devastating of all infectious diseases ever recorded in the history of human beings.
Yeah. Highly preventable, you say, but what is it that makes it to be severe in other people where they would breathe it, not get sick, while others would show some more severe kind of side effects to it?
Okay, thank you. TB usually affects people with compromised immunity. What I mean by that is people that don't have a strong immunity. Anybody that has strong immunity, the best that happens to that kind of a person is that the TB will be curtailed from leading to a disease. There's a difference between TB infection and TB disease. When someone is infected with TB, what it means is that the organism is actually in that person, but the immunity of that person is not able to, is not allowing that infection to become a disease. But when the immunity is compromised, that means there's nothing stopping that TB from going ahead from infection to disease. That's what it means when I said some people are more immune to TB than others.
Yeah. Take us through the 3 stages of TB as it progresses through the human body.
I guess, usually when someone is infected with TB, usually when someone with the infection coughs, sneezes, or even talks around you and you feel the organism, when they get into the lungs, the first thing that happens is that the body will try as much as possible to curtail it by killing it. In some cases, what happens is that they totally kill it, but in some cases, they are only inactivated for some time. In a case where the inactivation is not very firm, what happens is that the TB will continue from that infection to become disease. So we have what we call TB latent phase, TB infection, TB latent phase, and TB disease. That's the stages in which TB goes through when it enters the body.
Have we become, Doctor, more proficient and maybe more advanced technologically in terms of our testing capacity and our diagnostic capacity on the African continent, or is there still a lot of ground to cover?
In fact, the diagnosis of TB is becoming a headache to the practitioners, especially to diagnose TB in children. It's not easy to diagnose TB in children. A lot of new techniques are being researched on to find a solution to how to diagnose TB. But currently, what is being used is in endemic countries what we call gene experts and through assay. Those are the 2 major tests being used to diagnose TB nowadays. But it's very, very difficult to get something very accurate in diagnosing TB because all these things are not 100% assured to diagnose TB.
Yeah. And so how can we still, as you put it, win the war against TB on the continent? What would need to be prioritized and what would need to be the main focus of the countries and nations?
Pardon, I didn't get what you said.
I'm saying what would need to be our priority focus areas if we are to win the fight against this bacteria?
Surely we need to strengthen our diagnostic ability. At the same time, we have to encourage people that have this disease to really use their drugs efficiently, because most problem we have is from people that don't usually complete this treatment. The funny part of it is the most common symptoms of TB is cough. And when you start this TB treatment, within 2 to 3 weeks, in many people, cough stops. And a lot of people quit TB to cough. Immediately cough stops, they stop taking their treatment. And in that case where they stop taking treatment, what happens is that they may feel better, but it's just a temporary relief. And when TB comes back, it becomes what we call resistant TB. In that case, that means the drugs will not be able to cure the disease again. And anybody they infect with that kind of TB also have that resistant TB, and they are very, very difficult to treat. So the enlightenment should be the focus should be on enlightening the public about how to take their drugs efficiently, and how to do more researches into discovering a lot of tools that can be used to diagnose TB.
Yeah.
And I think as of now, the drug being used is very effective in curing TB. Most of the people treated are always achieving cure. So emphasis should be on diagnosis and encouraging people to use their drugs.
During the COVID-19 pandemic height, what we were being given is some critical information on how to keep ourselves safe and taking care of those non-pharmaceutical protocols, washing of hands, wearing your mask, social distancing, and so on and so forth. What measures, what precautionary measures can be taken by children in particular in countries where there is a high burden of TB? What measures should they follow?
Funny enough, TB shares the same precautionary measures with COVID-19, because since it's an infectious disease that is transmitted through the air, so if the people suffering can wear their mask and wash their hands after cough, and not using their hands to cover their cough, it goes a long way in preventing the spread of the tuberculosis. And in children, it's very complicated in children. Some children will not even present with cough or with the typical symptoms of TB. But what happens is that the caretaker of the children should take good note of any child that is stunting in growth or significantly losing weight, so that they can easily take them to specialists to diagnose TB in them. It's very, very, very important for TB to be fastly diagnosed in children, so that they can access treatment fast, because TB kills them faster than even adults.
Dr. Famuyiwa, appreciate your time. Thank you very much for coming on. Dr. Maclawrence Famuyiwa, a public health expert there, raising the alarm on tuberculosis, saying if we follow the necessary precautions, it still can be defeated. Now,